You're watching the Wellness Hour Live. I'm Randy Alvarez. Today's topic, new shaped breast implants. With us, we have an expert on the topic, Dr. Neal Handel. Dr. Handel, welcome to the program.
So nice to see you.
Now, I've been told, and we invited you on the program, but I've been told that the shaped implants don't make a difference because they end up just falling all the same way.
Well,
so we'll start there. Does it work?
Well, it absolutely does make a difference in the right patient. I need to give you a little bit of the historical perspective. Shaped implants, that is implants that had this kind of anatomical teardrop configuration, were on the market in the United States 20 and 25 and 30 years ago. Because of FDA restrictions, they were taken off the market, and the only kinds of implants that were available to American women were round implants until enough additional data was collected to prove the safety of shaped implants again. The three manufacturers in the United States have all successfully managed to jump over all the FDA hurdles and get their products.
So this is new. This is brand new.
They're new in the United States, but I want to make certain that patients understand that they're not really brand new. The concept's been around for a while. It was taken off the market in the United States until the safety of silicone gel implants was proved beyond any doubt, and now the shaped implants have been reintroduced, and I think have a lot to offer for patients.
Would you say the future of breast implants for women will all be shaped?
Well, it's interesting because in the United States, probably 95% of the implants that are inserted are these round devices, whereas in Europe...
Give me a side view of that for the camera.
The round implant looks something like this, and of course, it does take on somewhat of a teardrop shape.
Yeah.
But the shaped breast implant...
Let me see the other one.
The shaped implant is specifically designed to have a to provide a more natural contour to the breast.
So it starts thin at the top, like a regular breast,
like a normal breast that has is straight or slightly concave at the top, and projects more and has more lower pole fullness. Now, many patients want this look. Many plastic surgeons think this is a more natural, prettier look. There are other patients who actually come to me and say, they see this implant and they say, no, I don't want that. I want the full round upper pole, the Sophia Loren looking breast. For those patients, this might not be the ideal product, but for many patients, this does offer an excellent alternative and may give a better aesthetic outcome.
Are those implants more expensive?
They are a little bit more expensive. Yeah,
like
these are
$500 more a piece?
$400 or $500 per pair, something like that.
If it were a personal friend of yours, would you urge them to get the shape for a basic augmentation?
Here's the way we do it. First of all, we need to assess the patient's physical characteristics in terms of the amount of skin laxity, the position of the nipple, the degree of breast drooping. We then also try to get a handle on what type of aesthetic result the patient is looking for. If a patient comes in and says, I hate seeing breasts that look augmented, that really turns me off. I want to look natural. I want to have a slope on top, but I want to have nice projection. My breasts are a little droopy. I want them to be fuller, better cleavage. Then for that kind of a patient, the shaped implant is an excellent choice. For patients who
You just said better cleavage.
Better cleavage.
That will give a better cleavage?
It will give better...
Or an illusion of a better cleavage?
I think it gives an illusion of better cleavage. A lot of cleavage depends on how the surgeon places the implant. Obviously, if you place the implant too far up to the side, you're not going to have any cleavage. Or if you do, it's going to be in the wrong spot. If you put the implants too close together, then you lose your cleavage and have a condition we call synmastia, where there's actually loss of cleavage. But I think what this implant does is, because it gives more projection in the lower pole of the breast, it gives a nicer shape to this inferior and medial portion of the breast. So, these devices have a place. They're not for everybody. Some plastic surgeons have had no experience with this implant, and they're not even going to present it to patients as an option. But for patients who have the correct anatomic prerequisites and want a particular aesthetic outlook or outcome, this can be a very good device.
So do you call them anatomically correct implants? What does a woman ask for when she calls the doctor?
What a woman usually asks for is a teardrop implant.
Teardrop, okay.
But what we call them is form-stable shaped implants. And the reason is because the gel in this implant is actually what determines the shape of the implant, not the shell. If you take the shell off, it's still a teardrop-shaped implant.
Oh, interesting.
So they're called form-stable because the gel is more highly cohesive. Another advantage of that is there's less chance of rippling and waviness. Look at how much this implant ripples and waves. Can you see it? Holding it like that? Compared to a round implant when I hold it up.
Oh, interesting.
So for a thin woman who doesn't have a lot of tissue to hide the implant, this can often be a better shape. Or for a patient who has this kind of implant and has waviness and rippling,
What
substituting
could a
this type
plastic surgeon
might be
say
better.
about this and disagree with you? Are there any plastic surgeons that will say,
Yes, of
they
course
all
there
fall
are.
in the breast, it
Yeah,
doesn't
yeah,
make a difference?
There are plastic surgeons who will say, you know what, it doesn't matter because once it's inside the breast just kind of is laying over it.
They are wrong?
They are wrong in most cases. There
Okay.
are certainly some patients, let me give you an example. If a woman comes in who's got a very abundant amount of her own breast tissue, maybe a full C cup, and she wants to go to a D, it probably doesn't make too much difference whether you put in a round implant, a shaped implant, or a box of Cracker Jacks. You know, it's going to make her breast bigger. And she's got so much tissue hiding it, you know, that it's like a ski parka. You can't really see what's underneath it. But most women aren't like that. Most women have some, you know, most women seeking breast augmentation do have some restriction in the amount of breast available to work
So
with.
shaped breast implants are, I mean, you're a believer in them.
For the right patient,
For
yes.
thin patients especially.
For thinner patients and for patients who have mild degrees of breast drooping, and for patients who want that natural shape. That's really the key.
Okay.
They want that natural, pretty looking, unoperated, kind of youthful breast. I think shaped implants are excellent.
Okay, good. Now we're almost done with this segment, but at the beginning, we didn't talk about you. I mean, you're known all over the world as a breast guy and a lot of other things, but you have published articles on breast.
Many, yes, many.
I mean, for people watching this across the country, I mean, big practice in the Los Angeles area, Beverly Hills. You've been the go-to breast man out here for many years.
I think I've been recognized even by my colleagues and patients as
I
an
told
expert in
somebody-
this area.
I told somebody that I was interviewing you today. Another plastic surgeon that's coming in today. She goes, "You've got to be kidding me." I'm not kidding. I have a plastic surgeon coming in about 3
great.
hours.
Wow.
It's
All
a
right.
big
Well, I'm
fan of
flattered.
yours.
Good. I'm
And
flattered.
so you teach other doctors.
I do, and in fact, I was instrumental in working with the manufacturers of these implants to develop the teaching modules for surgeons to help them learn how to use these new devices. You know, the younger surgeons who weren't around 20 years ago when we had these.
Okay.
And I've done a lot of clinical research, written many books and articles in peer-reviewed medical journals about my experience with different types of breast implants, outcomes, complications, how to avoid risks, how to fix problems. So that's my area of interest.
What's the number one, and we're just about out of time,
Sure.
number one misconception women have about the procedure, about breast implants?
But it's a no-brainer that it's an easy operation and not much can go wrong.
That it takes no artistic talent
correct.
in the doctor? It seems pretty straightforward.
It does, and I think a lot of women think, how difficult could it be? You make a cut, you create a pocket, and you stick in a bag. There's a lot more to it than that. Many factors have to be taken into account. Whether the patient's chest is symmetrical, whether her spine is straight, how much soft tissue she has, how active she is physically to determine whether to put the implant under the muscle, on top of the muscle, what incision to use. We can use armpit, we can use around the breast, around the nipple, under the breast, even the belly button now. What type of implant? Should it be round? Should it be moderate profile, high profile, low profile? Should it be shaped? And there's not just one type of shaped implant. There are many variations in terms of the height, the width, the projection. So there's a lot that goes into this, and it takes, I think, years of experience doing it and a thorough understanding of the physiology and anatomy of the patient to really help her pick the implant that's going to give her the look she desires.
Is this true that other plastic surgeons, other board-certified plastic surgeons, you've done breast surgery on their wives?
Oh, absolutely. And daughters. Yes.
Why wouldn't they do it themselves?
Well, there's a couple of reasons for that. I think sometimes they just feel that they want the patient to have a change of venue, obviously, and maybe
Okay.
keep a little bit of distance. I respect that, and I think that's reasonable. I think
Have they ever told you, I think you're better?
Well, I think a lot of them just know that I have a lot of experience, and they say, look, I'm confident in you doing my wife or my daughter.
Okay. And we're out of time, but what should somebody look for in a surgeon that's going to be doing these shaped breast implants?
Experience. The same thing they should be looking at when they're choosing any type of physician for any procedure. What's the doctor's experience? Has he done this type of surgery in many patients over a period of years? Because when it comes down to it, we all know how to put in stitches, and we all know how to tie knots, and we all know how to stop the bleeding. But when it comes to clinical judgment, that's something that takes years and years of practice in the operating room to learn, just like with anything else.
Now, you're in Santa Barbara now.
I
Do people
currently in
fly
Santa
in there?
Barbara.
Do people travel to see you?
I've got somebody coming in from Dubai next week. have patients from all over the world and all over the United States on a regular basis.
Okay, good. I want to thank you for coming on the show. So shaped breast
Thank you so
implants.
much.
They're
Yeah.
safe, they're effective, and they do make a difference
They
in the
make a
appearance
difference
for the thin woman.
in the right patient.
For
yes.
augmentation. All right.
Correct. Absolutely.
You've been watching the
Thank you.
Wellness Hour Live. I'm Randy Alvarez. We'll be right back.